Okay, so recording's going, and let's pick up where we left off. Again, if there are questions, I'll leave some space at the end so we can go into those. I'm going to put my camera back up high so you can see me from all angles. Right, working with emotional behaviors. This is the stuff that's going to take this time and the first half of next time, or the first 2/3 of next time. And it starts out with formulate the emotional behavior, identify the triggers, using diaries, then looking at ways of changing situations, looking at changing triggers so that they don't hit you in the same way, and then looking at emotional approaches more directly, one of which is going to be exposure. Now, exposure will work fine for anxiety, it will work fine for disgust, it will not work fine for other emotions. Just remember, if exposure works on human processes around anxiety, anxiety is pretty responsive to exposure. However, if the emotion is something like, for example, anger or shame, it's far less likely to be effective. So for anger or shame, we go into more cognitive approaches. And I'm going to take you through those as well, starting today, carrying over to next time. That's broadly speaking what we need to remember. Don't assume that when I talk about exposure, it will work for everybody, because even I'm not saying it will. And I quite like exposure. Now, one of the things we're going to do is we're going to talk with the patient about that diagram, the Newton's cradle. We're going to say, let's try to understand why you have these emotional problems. So we'll look at what going back to Cara's point, we won't look at a general case, we'll look at a specific case for you as a person. So for you as a person, we know there's a link between certain triggers and certain behaviors like binging, cutting yourself, whatever it might be. But now we need to think what works to explain that for you as a person. And that's our job at this point, explain it for that individual. How do we do that when it's really hard to think about your own emotions because it feels scary to do so? And when you're looking at core beliefs, which one of the critical things to remember about core beliefs is we assume that's how the world is. We don't notice any alternative possibilities sometimes because that is how the world is. I remember Helen talking about core beliefs as being a bit like oxygen. You don't notice it's there. You just get on with breathing it, and that you don't even have a concept of oxygen. For many, many years, human beings had no idea that we breathed oxygen. It was just assumed we breathed. And what we need to do with our patient is get used to the fact that they've lived with this stuff for so long, they can't imagine it being a different way. They can't imagine what the world will be like if they had a different way of thinking. So it's really hard for them to identify patterns in their own belief because they're operating as if that's just how the world is. There's no choice about it. That's just how the world is. So in order to help with that, we go to diaries. And there's a version of this diary on the website, so you can get hold of it there. But here we've got a diary of potential triggers to using unhealthy eating behaviors. And you'll notice, like most diaries, it does the thing of, okay, what's the time, when did I last eat, so we can be sure it's not about starvation. But also, what's the context? Where was I? Who was about? What was going on? What was I doing? And then what was the eating behavior? So let's say in this case, binging, like I say, it could be vomiting. There's a whole set of other behaviors it could be. But let's say binging for the moment. What thought can you remember? Now, I will usually say to the patient, if you can't work that out the first time in your homework, don't worry about it. We'll go over a couple of examples. What emotions might you have been experiencing? Again, if you can't work it out, we will come back to that bit. And then what do I actually do? What's the behavior? That's usually much easier. I binge, I threw up, I got angry at my family, whatever it might be. So we start out by saying, okay, I get it. we can identify the trigger fairly easily. We can identify the outcome fairly easily. But we're going to have to help you understand the core beliefs and the emotions. So those are going to be things that we move on to when we are looking at core beliefs as part of this process. But if we can identify the problem is more about anxiety, we might be doing exposure work instead. I have to say the great majority of what I'm going to talk about today that you will find useful with these patients is the stuff about attribution. And then next week, the stuff that's about imagery rescripting, because a lot of this stuff is quite, as I say, it's trauma related. It's often much more than immediate anxiety. It's more about shame. It's more about guilt. It's more about, the emotions that don't respond to exposure. But that's not to say it will be. We start simple, we go more difficult if the simple stuff doesn't work. So if I can identify with the patient that they can identify the behavior, they can identify the trigger, they can identify its anxiety, great, I can get straight onto exposure work. If, on the other hand, none of that is there, particularly the anxiety, then I'll be thinking, this will take a couple more sessions and then it would have done. Sorry about this. Just work out how to make the thing work. Okay, so the first thing we do, remember, I'm starting simple. Occam's razor. I go for the simplest approaches that we might use. You won't use them with many people, but if you do find they might be useful, they could be great. So here we start with when it feels like a habit to the patient. I just do the behavior. I can't even work out what the trigger is. So you look at the Newton's cradle formulation and you say, we've only got the behavior. We don't have the core belief. We don't have the emotion. We don't have the trigger. Then this is when we will say, okay, if we really can't work those things out, we go to the habit reversal literature. Now, I'm not sure how many of you are familiar with the habit reversal literature, so I'm going to go at it as if you weren't, but please do excuse me if you're very familiar with it. Habit reversal is a technique that's used for behaviors which are, believe it or not, habit-based. So things like hair pulling, trichotillomania, skin picking, even things like stammering can be, seen as, habits which have been learned, but where we can't even find out what the learning is about. So what we do is we say, okay, we want to push your awareness up of when you're about to do this, even though we don't know what the triggers are. We're going to identify when you start feeling rigid. When do you start feeling like being sick, for example? That's a classic example of something where the patient can't identify. And the answer might be, well, it happens around this sort of time of day. And I'm thinking about a particular case of mine who we eventually got to what the trigger was, but it was way after we treated the problem. She just, around 7:30 each evening, it didn't matter if she'd eaten, whether she'd eaten or not, around 7:30 she felt like being sick. And she would make herself sick. And she just said, it's my 7:30 vomit. That's it. And that's what I do. I've always done that for years. Eventually, we found that actually 7:30 was about the time that her mum would often ring her, and she was very nervous about her mum ringing her phone, quite critical, but she couldn't get that at the time. So what we did was we said, okay, let's use a fairly traditional habit reversal approach, which is where you identify the behavior and you identify an incompatible act. So I'm going to vomit, it's just a habit, but I couldn't do it if there were other people around. And that's what my patient was talking about. I couldn't do that with other people around. Okay, so you start raising awareness. What is the behavior more likely? No, on my own at home. At about 7:30. Okay, so if we've got an incompatible behavior, like knowing that having other people around would stop you, what could you do instead? What could you do that would be incompatible with the habit behavior? This is what we mean by habit reversal. Now, if I had a nail biting problem or a hair pulling problem, the reversal behavior might be stick your hands in your pockets. So when you get the urge to pull your hair like that, twist it, pull it out, etc. Identify that urge, put your hands in your pockets, keep them there, because you can't reach your hair from that point. And wait for the urge to go down. Keep your eye on the urge, even though you can't identify why you've got the urge. Keep your eye on it and see what comes out. And usually we find after about 10, 15 minutes, that urge, this suds vibrating 1 to 10, goes down, goes down, goes down, until you get to the point where you're thinking, you know what, I don't have that urge anymore. So with vomiting, we might say to the person, okay, what I want you to do is ring a friend and talk to them for half an hour until you realize that the urge is going down. Alternatively, go for a walk out in the outside world where you'll be too publicly visible. Go and call a friend, anything that says, okay, I can't use the behavior that I want to use right now, and keep an eye on the urge so you learn that the urge goes down. That's really simple. I've used it a few times over the years, and where it's been appropriate, it's been very effective. However, that's kind of on the surface of the kind of emotionally driven stuff that we're talking about. Mostly we get to what the emotions are, and we're better at dealing with those more directly. So that's a kind of initial, just all we can see is the behavior. Let's find something incompatible with that behavior. What happens when we can work with the emotions more overtly? Well, first we need to identify them. Again, there's lists like this on the website. So I use a checklist like this. I say to the patient, okay, I'm aware that sitting here in this room, you can't identify what your emotions are. But over the coming week, I want you to keep a record and just put a tick against angry every time that you're angry. Against anxious every time that you're anxious. We do give them a code sheet, which is a bit of a better definition of each of these. And then come back next week and we'll see where the ticks lie. And of course, the patient will often go away going, I don't have these emotions. And by the time they come back, you come back and you find there's maybe 15 ticks against anxiety and a couple against sad or depressed. And it's really clear at that point just what's going on for the patient. Okay, I haven't got the big picture, but they'll give you lots of little pictures that say to you, we should deal with anxiety or we should deal with sadness. So keeping a checklist like that, and by all means, add other emotions in if you like. The happy one, by the way, at the bottom, I don't know if you're familiar with this, there's a small literature saying that for some patients, if they get happy, they feel guilty. And if they feel that way, they feel, I shouldn't feel so happy. And they really should try to control the happiness. It's an idea that I think Hubert Lacey first talked about in 1986. So it's not a new idea, but it is one to bear in mind because it does happen sometimes. So I want the patient to understand what those emotions might be. And we'll keep a diary to try to get them to identify. And if they can't identify, we go back to the original diary, them there, and start to help them fill in the holes. So what emotions might you have been experiencing? I don't know, I wasn't feeling anything. So now we can say, so what do you think somebody else would have been feeling in that situation? Let's say it's your sister. Your sister's boyfriend has stood her up, not just your boyfriend has stood you up, but your sister's boyfriend has stood her up. What do you think she'd say about that? What do you think she might be feeling? Oh, she'd be really angry. She'd call me up. She'd tell me she'd really hacked off with him for letting her down, etc. Okay, do you think that could be a bit of what's going on for you? Because we want the patient to get used to the idea of maybe this is quite normal behavior, to feel this way. Maybe I'm allowed to feel it too. And using other people is often a good way into that. So we'll be trying to fill out this diary more fulsomely, get the emotions, etc. And we use this checklist to help the patient identify which emotions are big for them. That's a fairly simple, straightforward way of doing things, hopefully. I said earlier, you might get somebody who's got loads of anxiety and a bit of sadness. Again, if you have, that's good exposure territory. My bet is you're going to find quite a lot of people where the emotion is more about being angry or guilty or lonely or ashamed, because those emotions have got more social um, issues going on for them. Remember, and Paul Gilbert talks about this a lot, socially based emotions tend to be the ones which come out of a lot of very horrible traumatic experiences. The guilt feelings, shame about being abused, that sort of thing, all have a social component because we're thinking, what do they think of me? Or we're feeling angry at somebody for what they've done to you. Anxiety is more kind of internal. The other emotions are more external or externally locused. They have that problem of I'm trying to think of a nice way of putting it. They have that feeling of I'm really pissed off at somebody else. There you go. That's as nice as I can get. So if it's more anxiety based, and it won't be for the majority, but if it is, stay simple, then what we're going to do is use exposure. We're going to use exposure with response prevention to delay the behavior. Now, I'm pretty sure you've seen this if you ever worked in an inpatient unit, for example. Lots of inpatient units, if we have the meal, then we lock the bathroom doors so people can't go and be sick. That's an attempt at exposure. It's not terribly effective for reasons I'll go into another time, more about white knuckling than exposure. But where there is emotion, what we really want to do is keep the anxiety in the person's head. So instead of blocking out the emotion, we'll have a relaxation class or let's do some mindfulness. We actually want the patient sitting there thinking, how does my body feel, etc. How do I cope with this? And we can use distraction, like getting the person using tobacco behaviors, using big diaries, etc., to keep the person focused in on the kind of core task of make sense of it. But we don't want to use compassion work or relaxation work because, again, they'll lower the anxiety artificially and the person won't learn so much. As I said before, I have no problem with things like mindfulness, self-compassion. Just don't try mix them up with exposure work. And of course, if the exposure work doesn't work, if we say, okay, I get it, you've got this urge to binge, it's related to how anxious you are. I want you to sit for 40 minutes thinking about the anxiety, thinking about how your body feels, and then we will we'll do the exposure work around that by keeping you focused. Then, if that works, great, you cut the anxiety down. If it doesn't work, then it probably wasn't anxiety that's the problem. But it's worth trying out once with the patient, especially if they've already done exposure work. Otherwise, we're going back to the core beliefs, which we haven't done here, but we're going to. Before we do that, though, I just want to show you what the exposure would look like. So I'm going to do my magnificent changing over slide presentations again. Yeah, can I do this? Good God, I think I can. Okay, so I'm going to try playing this through for you. So you can see what the exposure might look like. And then we'll come back and start talking about, okay, how do we deal with the if you like, more stuck emotions, more socially oriented ones? If you've got any queries, save them up, come from at the end of the video. About 12 minutes long, this one, I think. If I can find the right button to press. I think this should do it. No, it's the wrong thing to press. Okay, here we go. Let me know if there's any problem with the sound, obviously. Okay, Jess, what I'd like Sorry about honest, folks, I have absolutely no idea how this video has come up. If you ever get the chance, it's a bloody brilliant video. Hold on a sec. I'll try again. Okay, I think I've got it back. I'm going to try it again. Let's start sharing that one. What I'd like to do now is follow up on what I talked about last time and start looking at some of those emotional factors. The emotional area that you've identified as being the big problem is what we call, what I think is social anxiety. It's that worry when you're out with other people, or when you meet with other people. And I don't know if this makes any sense to you, but most commonly when someone's socially anxious, the big worry is, what are they thinking about me? The kind of fear of negative evaluation. Does that sound sensible in terms of what you experience with them?
Yeah, that's definitely my main thing. What other people are thinking about me, because I just feel like it's always going to be something negative. Yeah.
So what kind of things do you imagine they're going to be saying to you or saying about you?
Just maybe like, oh, look how much they're eating, or how big they are. Like, they don't look really out of proportion. They look really big, and or like if I'm talking, maybe I sound stupid, or yeah, those sort of things.
Okay. All right. Well, I think there's two things here that we can address. One is that emotional experience. The other is the beliefs about what people are thinking. So right now, I'm going to deal with that emotional experience. So looking at your diary, it looks like you're saying you make yourself sick a little bit before you go out with your friends. Is that right?
Yeah, that's happened the past few times I've gone out.
Yeah. Okay. So can you take me through the most recent example? What happened? What day was it? When were you meant to be going out? Whose idea was it? What ended up happening in terms of your eating, and then after that?
Yeah. It was Friday, like maybe about lunchtime. My housemates texted me and said, oh, we're going to go out for dinner tonight. So already from lunchtime, I was just thinking about it, churning it up inside. Then by the time I got back from work, I was just feeling more and more nervous about it, like going out with other people, because it was a restaurant bar again. And I obviously didn't eat dinner before I went, because we were going out for dinner, but I didn't eat a snack, and I just was churning it up inside, and just being sick before we went out just made me feel that little bit calmer just before we went out.
Okay, so being sick made you feel calmer.
Mm.
Okay, that's not unusual. There's various different explanations for that. One of which is you just get used to, when I'm sick, I feel less worried about my weight, and that makes me less anxious. But there are other explanations as well. I think the critical thing for you is that's what works for you. It makes you feel calmer. Did that mean it was easier to go out?
Not necessarily. I mean, I still found I was still anxious. It was just literally for a few minutes after I just felt like, okay, maybe I can do this. But then, yeah, still get anxious about it.
So it's helping you cope with the anxiety. It might or might not be helping you to get out the door, which says it doesn't last very long. Is that fair to say?
Yeah, I think that's pretty accurate, yeah.
Okay. So over the course of that day, from the point where your friends texted you, You said you could feel the emotion churning up.
Mhm.
Is that fair?
Yeah,
Okay.
yeah, sort of like how we talked about before. I could just feel it in what I thought was my tummy, just like, nerves and yeah.
Okay, so you've got what we talked about in terms of a really typical anxiety reaction. And that's perfectly understandable because anxiety is about uncertainty.
Mhm.
Now, there are different levels that we can address this on. And because it's really important we don't make things too complicated, if we can do it straightforwardly, we'll do it straightforwardly. And if that doesn't work, we'll move on to more complex ways of addressing it over the next couple of weeks. Does that sound okay?
Yeah, yeah.
Okay. Now, one very simple way of avoiding that kind of anxiety is to avoid it from the very beginning. In other words, from minute number one, avoid your friends ever asking you. So you could imagine saying, well, my way of not getting anxious about this stuff is to tell my friends, I will never, ever go out with you. Don't ever make contact with me about it again. And then you'd know that you'd be pretty safe from having that experience. Does that make sense?
Yeah, it makes sense.
Okay. Is that how you want to live the rest of your life?
No, definitely not. No.
Okay. You see, if what they were doing was something that was kind of that you could live without, I'd say, well, we could think about never letting yourself get near that trigger. But it does sound to me a bit like it'll be a shame to live your life without having the ability to make and keep friends that way.
Yeah.
Does that make sense?
Yeah, like I feel as much as I feel anxious going out, it is something I want to be able to do. It's a normal thing. It's a nice thing that people do. So I want to be able to do it.
Okay. And I suppose one obvious question, do you like your housemates?
Yeah, I do actually like them. I don't know why. Like, I know they probably aren't thinking nasty things about me, but it's hard to believe that they're not and other people aren't. Like, yeah.
Okay. Like I said, we'll come on to that one shortly. But right now, what we've got is a situation you'd like to be able to engage in, which is go out for meals and drinks with friends, spend time with people. But that anxiety about what it's going to be like churns you up, and you end up using vomiting to cope with it. Okay, we're not going to say never go out with your friends again because that wouldn't really work for you. So what I'm going to suggest is that we try something a bit different. Okay, and there are two possible strands here, but in both cases, what we're trying to do is get you used to that exposure thing that we talked about with food. You remember that one?
Yeah.
Okay, so when it was with food, we asked you to sit there with the anxiety for as long as you could and learn that over time, maybe 30 minutes, the anxiety goes up and then comes down. That's a natural process. You run out of adrenaline, your anxiety will come down. However, we need you to be dealing with that all the way through. The churning up during the day suggests that you're kind of just going over it. The anxiety is being relieved by you being sick, but it's going to come back again. And like you say, it still sounds like it's there when you end up going out a few minutes later. So we've got two things that we could do. Number one, we could just say, do exposure when you get that level of anxiety. When you're sitting there thinking, right, the urge is to make myself sick. And that's the critical thing. When you get the urge to do the thing that you're scared of, or that you hate doing, but you end up doing anyway, I want you to sit there with that urge and just keep focusing on it. Don't try to hide from it. Just keep focusing on, okay, so how does my stomach feel? How's my tummy? Is that really related to how full I am, or is that more my anxiety? If I sit here with this for long enough, it will go away, but I've got to focus on it to give it the best chance of going away fully. And that would require you being able to do that for maybe half an hour. So that's what I'd really like to be able to get you to do. However, that can be tricky for people, especially when you've got that automatic reaction of just be sick and that will make me feel calmer. Okay, so I think probably we're going to need to try a bit of distraction and distancing as well. Now,
the important thing about these is I don't want them to stop you thinking about what's going on, but I want them to provide an alternative way of framing it up or an alternative way of experiencing it. So one possibility is when you get that urge to be sick, you go for a walk somewhere.
Mm-hmm.
You do, it's what's called habit reversal. When you get the urge to be sick, work out why. It's because I'm anxious. Take yourself somewhere where you can't be sick. And that way, you're forced to sit through the next half hour, maybe take a walk around the park, whatever it might be. You're forced to sit with that anxiety until it starts to fade and you're able to say, actually, I'm getting it back under control now.
Mm-hmm.
That's one possible. Does that sound like it's doable? Can you actually get out the door and go somewhere where you can't be sick around that time that you get that urge?
Yeah, to be honest, I think that sounds better for me than the other one, just like sitting with it. I think if I'm doing something, I'll feel better maybe, yeah.
Okay. Well, I would suggest we start with the distraction stroke walking one, and then we try moving on to the sitting with it one, because there'll be times when you can't do that. You know, there'll be a time at work one day when you're feeling really wound up. You're thinking, okay, I can't get away from this, so let's sit with the anxiety right now. But for a start, I think you're doing something like going for a walk. Another possibility is if you weren't able to go for a walk, sometimes what I'll do is I'll get you to complete a diary. And in that diary, it's going to be a long one. It will keep you busy for about half an hour, looking at your thoughts, your feelings, looking at the behaviors, looking at the alternative thoughts, the alternative feelings, the alternative behaviors, rating them, balancing them, juggling them. And the reason we'll get you to do that sometimes is because that can take you half an hour as well. So if it's a day, for example, where it's piddling down with rain, you don't want to go out for being struck by lightning, that can be an alternative to that way of approaching the problem. Does that make sense?
Yeah, that makes sense. That sounds okay.
Okay. So how about for this week, we say, whenever you get the urge to be sick, not when your friends make you anxious by texting you, but when you get the urge to be sick shortly before you go out, for example, you're going to go for a walk and you're going to, at that time, focus on the feeling about being sick. One thing that some people do is they take their phone and they hold it up and they look like they're talking to somebody on the phone, but actually what they're doing is they're dictating their thoughts into a voice recorder. You know, I'm feeling queasy right now because I'm really worried about what they're going to think about me, etc., etc. Until you've walked long enough that the queasiness has gone down. Does that sound reasonable?
Yeah, that makes sense.
Okay, so let's imagine, I mean, the last few weeks I've been asking you out a couple of times a week, so let's imagine that happens 2 or 3 times over the coming week. What I'd like to do is keep a record each time of what thoughts you had and how long it took before the anxiety faded. Okay?
Yeah.
And you can put those into your regular food diary.
Okay.
Okay?
Yep.
But most importantly, be able to identify that emotion. You know, I feel queasy, my stomach's churning, that's anxiety. Okay, how can I deal with anxiety? Okay?
Yeah, that makes sense.
Okay, so we'll put that into your homework list and we'll come back to that on the agenda next time. Okay?
Yep.
See, I knew there was something I should have been feeling anxious about. It's technology. That's the thing that always gets me. So broadly speaking, what you're seeing there is somebody who's doing the exposure work, or is being set up to do the exposure work, to keep a record of it, to make sure that they identify what the anxiety is, but don't respond to it. Just keep focusing on it to the point where actually I can see it going away. And that, again, is exactly what you see before with anxiety about having eaten too much. In this case, it's just with anxiety. So that's a fairly straightforward approach. But as I say, it won't work for everyone. It won't work for everyone because not everybody is going to have that same pattern of, if you like, response using a fairly straightforward emotion like anxiety. In short, there are going to be other emotions out there that we're going to have to pay attention to. So we're just putting up my slides again. Or putting up the slides again. Right. So what I want to do is get the, if you like, more complex emotions, the ones that are not something where you can simply learn by waiting for it to go away, that it will go away. So let me just move on, find the right slides to move around. Fine. Okay, so we're working with core beliefs. Now remember, core beliefs are those beliefs where you've got material that you need to work through to work on them. Core beliefs themselves are beliefs about how the world is. They're the things we don't notice that much because we don't actually consider there's an alternative a lot of the time. You know, I always like the football fan analogy. You know, if you talk to somebody who's a football fan and say, "Are you going to miss the game this week?" Their answer is, "I don't understand your question. You know, what do you mean miss the game?" So there's that assumption, as Tedeschi always pointed out, when you've got a core belief, a schema, then you really aren't questioning it because you don't think it's something that you ever question. And so the broad techniques for working with core beliefs, we've got historical review, we've got evidence gathering, we challenge attributions, and we use imagery scripting. That one I'll come back to next week. The other thing I'll come back to next week is counter-schematic behaviors. Because however good your cognitive work might be, ramming the point home with some behavioral change is always, always helpful. So next week, imagery scripting, counter-schematic behaviors. But what I want to do is take you through an example of working with these kind of core beliefs and then show you a bit of technique when it comes to working with attributions. Because so much of the time we tend to assume it's our fault. Think about trauma-based cases you have worked with in the past. Many, many people have had trauma experiences. The ones who are good at saying that was them tend not to develop the psychopathology. The people who develop the problems, eating disorders, PTSD, whatever, are the ones who have a over strong belief that somehow it's me. I've somehow brought this on myself. There's two broad types of core beliefs. We've got the ones which are, if you like, central to who we are. Things like I'm vulnerable, or I'm defective, I'm broken somehow, or I can't trust the world, or people always give up on me. Those kind of beliefs are, if you like, central beliefs about who we are, and they develop because of past experiences. They develop quite reasonably because of past experiences. And when I talk about Jenny in a minute, hopefully that will make sense. We've also, though, lower down, I probably should include social isolation in here. We have other beliefs which are about how you cope with that. If you think about the Beck model, when talking about core beliefs, they also have this loop called ways of coping. So how do I cope with the fact that I feel so bad about myself? How do I cope with the fact that I'm worried nobody will love me, or that emotions are dangerous? And the answer is we have compensatory beliefs too, ways of coping. So if I've got this belief the world is a dangerous place, emotionally speaking, in other words, an emotional lack of safety, then I tend to develop that emotional inhibition belief I was talking about before. Why do I develop it? Because as a child, I've had years of experience of emotions not being a safe thing to go for. So what do I learn? Don't go for emotions. Or perfectionism. If I have learned over the years, everybody criticizes me, everyone tells me I'm not worth it, I'm not good enough, etc. I'm going to try my bloody hardest. Or alternatively, maybe I'm going to cut myself off from the world so that nobody can see just how useless and pointless I am. These are more compensatory ways of coping in the moment with feeling really shitty about ourselves and about the world. Now I'm going to talk about ways in which those two can, if you like, interact and sit around a person. So what we're going to do when it comes to core beliefs, first we teach people about invalidating environments. We did that before coffee, you might remember. Second, we do historical review. Tell me about how you got this belief. Tell me about the context it happened in. In other words, does it have to still apply now? We're not saying that yet, but that is what we're going to be doing. And what's the evidence for that? Is it still true? Okay, so you were treated like that when you were young. Are you still treated like that? Or is it something that belonged back then? And then we want to challenge attributions. This is where we start doing more cognitive work about, does that belief hold true now? Now, if you remember attributional processes, the way that most human beings operate is we think if it's a good thing, it was us that did it. If it's a bad thing, we think someone else did it or it was bad luck. So if I win the lottery next week, I've put aside the fact I've never played the lottery in my life, but if I win the lottery next week, I'm going to think I chose brilliant numbers. On the other hand, if I lose at the lottery, I'm going to be thinking someone cheated. Or alternatively, they're trying to get all of the money to be sent to people in southwest England or something like that. I don't know. Never played the damn thing. And even as I'm saying it, I'm thinking about politicians who will tend to say, good thing happened, that was all down to our party. Bad thing happened, that's other people's fault. And if you can't find an example of that in politics, you really aren't trying hard enough. So what I want to do is get away from an attributional pattern. Now, the critical thing to remember, 3 dimensions of attribution. Okay, 3, if I'm holding my fingers up right, 3 different dimensions of attribution. Number 1, it matters whether I attribute internally, it was my fault, or externally, it was somebody else's fault. So did that bad thing that happened come from me or come from somebody else? Now, if you think about that in purely clunky terms, it might be, was it my fault that that person abused me, or was it something that they wanted to do and I had no choice? Most people will say bad thing happened because of them. But if I've got a mental health problem, particularly depression, eating disorders, anxiety, then I'm going to think it was down to me, even though I did nothing active towards it. Logic doesn't come in here. This is feeling at the time. So that what I usually find with my patients is they will think bad things happen because of me. Internal attribution. My job is to help them change that from internal to external. In other words, put the blame where it belongs. Does that make sense to people? Okay. And again, we're doing cognitive this week. We're going to move on to a more robust way of doing it with imagery rescripting next week. So that's another method of attributional shift. Second zone of attribution is, to what extent is this general or specific? So if, for example, I fail a maths test, that is going to make me feel really miserable if I think that that applies to everything in my life. On the other hand, if I say to myself, well, I'm no good at maths, I've never been any good at maths, I'm much better at English literature, then I'm not going to feel so bad about myself. So the more global I make the attribution, the more problem I've got if it's a negative thing. The more specific I make it, the more I would say, yeah, but that doesn't really apply here, does it? And then there's duration. How long will this feel like a bad thing? If I lose, let's say I lose a game of tennis. I'll say tennis because Wimbledon was on. I've never played tennis either. But if I lose a game of tennis, I might think, okay, that's it. My career is over. I can't play tennis anymore. Or I might think that's because I always play bad tennis on a Wednesday. So all I'll do is I'll arrange to play tennis every other day of the week. So the specificity of, is this something that is about general situation, but also is it something that has to keep happening? Okay, so I lost one game of tennis, but I've won plenty of others. Can keep you from getting depressed, self-harming, anxious, eating inappropriately, that sort of thing. Okay, so 3 areas. There's the time frame, there's the internality, there's the globality versus specificity. I want the patient to be thinking, that crap thing that happened to you wasn't about something that always applies and that is your fault and that will carry on applying forevermore to all areas of your life. I want them thinking, that was a crap thing that happened to me, but it isn't something that has to apply to the rest of my life. That's broadly speaking what I'm after with attribution work. So I'm going to give you an example and take you through those stages 2 to 4 there. Okay, then I'm going to show you a video, which is an illustration of it, and then we'll have a quick time for questions and break off and come back to imagery scripting in a week. Jenny, who I've mentioned already, she was a patient of mine who, I mean, she was a lovely woman. She was probably aged about 40, and she had this big habit of walking everywhere. She would walk and walk and walk. I'm not talking about, didn't take the bus. I'm talking about she would walk about 45 miles a day. She'd get up in the morning, pull on her clothes and her trainers and just start walking and be back maybe about midnight. At that point, she would binge on a large amount of food because she was starving and would get up and do it all again the next day. Now, her eating pathology was pretty severe, but her behaviors were all maintaining what she believed. I've got to keep walking, I've got to keep walking, I've got to keep walking, otherwise I'll gain weight. And I know I'll gain weight because when I'm not walking, I binge. So her big belief was walking was her safety behavior. I avoid the problems, but it also meant she avoided ever thinking about anything very much. She would describe it as, the main thing I think about all day is how much my legs hurt, how much my feet hurt. And we did have to get a doctor to look at her feet because they were in pretty bad shape. With that amount of walking, well, unless any of you are 45-mile-a-day walkers, I'm pretty sure none of us could really experience that one. So what happened with Jenny was that we sat down and we said, tell me about where this came from. Let's see if we can make sense out of it. And we looked at the history. The first few sessions, by the way, she could only do the session while walking around the room, just in case you think I've got a miracle power to stop somebody here. But she got calmer after a few sessions. Anyway, what we discovered was that her history made perfect sense of why she was doing what she was doing here and now. She had, at about the age of 6, she lived on a farm in Ireland with her older brothers and sisters. She was about 10 years younger than anybody else, and their mum and their dad. And they worked the farm, and Jenny was just this kind of youngster who had been brought up on the farm, going to school, etc. Everything seems, lovely and idyllic, etc. Until Dad develops cancer. And then everything goes to pot. Because previously she'd been this much loved 6-year-old child within the family, lots of brothers and sisters, family to look after her. And now everyone goes into emergency mode. Everybody starts either looking after Dad or looking after the farm. And no one had time for a 6-year-old. And she would find that, if she came in after school, everyone was either working or just collapsed with exhaustion. And no one had any time for her. They just say, look, we'll talk later on, or, go away, stop bothering us. So what she learned was, if I go for a walk, I'm not upsetting anyone. So she would go for a walk around the farm. And what she found was during that time, she didn't feel so bad about herself. So she just got used to walking further and further. And you're talking about a 6-year-old who would spend the whole day and start missing school to do it in the school terms as well. But she would spend the whole day walking. And she'd get home, and there was everybody slumped out in front of the TV or unconscious on the sofa. And still nobody had any time for her. So the next day she'd walk for longer. And nobody seemed to notice her. Now, I don't think it's that surprising if I say to you, she had developed the most enormous abandonment belief. People aren't there for me. People aren't there for me. And the reason for that was they literally weren't there for her. They were absolutely buried in keeping farm dad functional, alive, etc. And her assumption was, of course, I'm unlovable. Nobody can want to be around me. So her big problem, of course, was, how do you cope with that? And in her eyes, keep walking was the only answer. I'm unlovable. Keep walking, keep myself socially isolated from other people, and don't talk about how I feel. No one wanted to hear a 6, 7-year-old talking about how she felt when everything else was so crappy in life. So she tried to stay out of everyone's hair by just keep walking, keep walking, keep walking. As you can probably tell, not the best of situations for anybody. But her assumption was the problem was within her, and the problem would always be within her. And the problem was general. Not only was this about, it wasn't really about dad in her eyes. People weren't really explaining what was going on to a 6-year-old. So she thought, people don't want to know me. She internalized the attribution. She couldn't see an end to it, so she just assumed it would last forever. And of course, when she started using her compensatory behavior, go for a walk, that meant people had even less chance of being supportive. So when her dad died after about 2 years, she was virtually this missing member of the family. She didn't engage with other people because she was too terrified that they were going to think she was this horrible person they shouldn't talk to. So what she was doing all this time was developing a set of core beliefs that were absolutely understandable in that context. But remember, she's a 6-year-old. 6-year-olds are not good at identifying logical issues. Sorry about that. If any of you were wonderful logicians when you were 6, brilliant, good for you. But when I talk about imagery rescripting, one of the things I'll talk about is the way that when we're very young, we tend to store things in a very cognitive way. We tend to store things in a very emotional, perceptual way. We know that from the PTSD literature, we know it from the social anxiety literature, from the eating disorder literature. We tend to store things away when we're very young as being, it's an emotional experience. So what we have is a 6-year-old, 7-year-old, 8-year-old, and beyond, who had a big abandonment belief, lots of social isolation beliefs, lots of emotional inhibition beliefs, and they all made sense back then. But she didn't see them as being temporary things. She saw them as being permanent and as being her fault. So that attribution thing kicks in really hard. So what we then did was say, okay, so let's look at the evidence, as it stands right now. So are your family avoiding you right now? Well, no, not really. It's more that I avoid them. Okay. How do you think they'd act if you got in touch with them? I've got no idea. Absolutely no idea. What we could pick up was that the family were trying to make contact with her, but she just wasn't responding to it. But all we could see was there wasn't anything that she was doing right now that was problematic about her, other than the, if you like, the schematic behavior of keep walking, never engage with anyone. Unfortunately, that meant she could never unlearn the original learning. So we're left with that possibility in Jenny's case that what's going on is either that nobody does love her, she's completely correct, she's unlovable, she is always going to be abandoned, she should keep her emotions under check, she should never go anywhere near anyone. That is a possibility. The alternative that I'd put to her would be, well, maybe, just maybe, what you're doing is you're reacting to how life was back then, but maybe life is different enough now that you could try acting differently. This is where the counter-schematic behaviors come in. And that's where we start challenging the attributions. We start challenging does it have to apply forever? Okay, so it made sense for you to develop this belief back then. Does it make sense now? And I'm not after her to say, well, probably not, no. What I want is her to say, I don't know. Because that way I can get to try out the behavioral experiments under the counter-schematic behavior. I want her to be able to think, was there actually anything about you that meant that you somehow did this damage to your dad, that everyone was really horrible to you because you somehow killed your dad. And she'd again say, well, not that I can think of, I don't know how that would work. Okay, how would you react if that was one of your brothers or sisters who were blaming themselves? I'd tell them not to be stupid. Okay, what's different about you? So all the time, what we're doing is we're challenging those attributions. Is it necessarily true that this hassle or Trevor? Does it apply to all of you? Does it apply to you being the problem, or that life was shit at the time, or that other people were shit to you at the time? So that's broadly speaking what we're doing when we're challenging attributions. And of course, what we want to do is we want to get the person to the point where they're thinking, maybe there are other ways that I could act in the world, other behaviors I could use in this world that will let me actually work out whether this is true or not. In Jenny's case, it actually worked pretty well. We got to the point where she would start making behavioral change. And one of the first changes we made was get onto the family members who texted you. I think this is before WhatsApp was a big thing or whatever. But get onto the people who text you and say, I'm alive, I'm here, I'm really sorry, haven't been in touch for a long while. And if you're right, then they'll write back saying you're a terrible person. But you believe that already. But if you're wrong, they'll write back and say, oh, we've been so worried about you. Tell us how you've been, etc. When can we meet up? And we got her to make some of those changes. And actually it turned out family were just all positive about her. And that was, again, a complete surprise. But she could buy into that. She could see the cognitions changing as a result. In some cases, the cognitions won't change. And that's where the belief has been laid down very firmly in what's called an encapsulated belief. I will talk about that more next time because that's where we use imagery rescripting. So what I'm going to do is I'm going to show you this second video, if I can actually press the right button on it. That'll take us about 15 minutes or so, and then see if there's any final questions before we knock off and I give you your task for later on. Okay. So find other tab. Good. Try not to mess things up. Even better. Okay, this should be it.
So Jess, last time we talked about, those times when you get that urge to be sick before going out with your friends, etc. And what we were suggesting, or what we agreed to do, was that you try either some distraction or some exposure work, some things that would stop you from actually being sick, to see whether the anxiety went down of its own accord. How did you get on with that?
I mostly tried the one where we said I'd go out for a walk when I got that feeling that I wanted to be sick. And it did kind of work for like the half an hour I was on a walk, but then I just got back home and it was still there really. It hadn't really gone away. I wouldn't say it was that successful, to be honest.
That's okay. No one's expecting perfection. If you remember, I said last time, this is the first step. If that doesn't work, we think a bit further.
Mm-hmm.
So the times when that doesn't work tend to be when we're dealing with more just a kind of in the moment emotion. Often they're when we've got what's called a core belief being triggered as well. So that a core belief is a belief about who I am. It's the kind of thing you lay down when you're very young. It's affected by how you're treated, who you are, the way people are to you, whether they're nice or nasty, etc. So core beliefs can be really positive. I'm a happy person, I'm a person who fits with the world, or they can be more negative. They can be things like people think bad things about me, etc. So what I want to do is I want to get to a clearer understanding about what the beliefs are that are being triggered when you get that urge to be sick. So I can really make sense out of it and maybe help you to think about other ways of processing the thoughts rather than just the emotions. Is that okay?
Yeah.
Okay. Now, because we talked a lot over the last session or so about the way people see you and your beliefs about the way people see you, I wonder where that's come from. I'm kind of wondering whether this is something that goes back a long way in your childhood about the way people have seen you, about the way they've treated you, etc. That's kind of triggered a belief in you about, I can't be good enough, or I'm going to get it wrong, or whatever it might be. So how do you think you were seen by your family, for example, or your teachers when you were young?
Said I've always, from as far along as I can remember, just always felt like I can't do anything right. I'm hopeless. Like, my parents have always kind of made me feel like that, but I guess like that's because I was like that, I guess, if you know what I mean. Like, I was kind of just hopeless, couldn't do anything. Like, teachers weren't too bad, I guess, because they have to be nice, but yeah, my parents were quite critical, I guess, of my achievements and how I was at school and at home, and so yeah.
Okay. So your teachers weren't like that, did you say? But your parents were?
Yeah, teachers weren't too bad. I mean, I already went to school feeling like I was just rubbish at everything anyway. And like I said, teachers kind of have to be nice to you. You know, I'm thinking as far back as primary school. So I'm remembering it more coming from my parents, I'd say, than my teachers.
Okay. I just think it's always important to remember that if it were about you, it should apply everywhere. And I don't know what kind of school you went to, but sometimes teachers can be quite hostile. It's one of those strange things we forget sometimes. But let's go with what you said. It's more about how things were at home. Okay. So it sounds like they were very critical of you. Is that fair to say?
Yeah, it's fair to say that I guess they were being critical, but it's not. I suppose it's not their fault that they're saying that. It's because I was those things. Like, they were just saying it how it was, I guess.
Okay. So are you saying they were critical of you, but not of your brothers and sisters, for example?
They were kind of critical of my siblings as well, I guess. Yeah.
Okay. So were your siblings failing?
I mean, I didn't think they were, but I mean, my mum and dad said it, so I've just always grown up thinking that they, you know, your parents know more than you do, so just believe them, I guess, when they said it.
So if you got a good mark at something and you took it home, how would your parents react to it?
They just be like, well, it's still not good enough, because, you know, unless I was getting like the top marks, there was always room for improvement. Like, it still wasn't the best I could have been.
Okay. And I mean, I'm beginning to get a picture here, which is, it sounds like you had a lot of criticism at home, and your siblings had the same kind of thing. And you kind of started to assume this must be justified, this must be fair.
Yeah.
Is that the pattern?
Yeah, well, I still kind of believe that. Like I said, your parents know their kids well, and that's just how I believe them.
Okay. I'm not arguing with you. I'm just trying to understand how you've got to where you are right now. This might be a difficult one, but why do you think your parents were critical? Was it all about wanting to get you to do better, or was it something about their lives? What do you think might have caused this critique of everything?
I don't know. I feel like it did come from a good place. They just wanted the best for me, and that just meant, you know, I just had to try harder constantly. But it was for my own benefit, so that, you know, later in life I got what I wanted and did well in life.
Okay. How did your parents do? Did they have what they wanted in life?
No, not really, which I guess is maybe why they really want their kids to do well. Maybe they don't want us to go through what they've been through. And
Okay. I want you to imagine something for me. Okay. Imagine you've got a child of your own. Yeah. Let's say the child is 5. Okay, and they go to school and they're not doing very well in their first term. You know, they're doing absolutely fine. You know, in terms of, you know, teacher says, no, they're really happy, they're cheerful member of the school, but they, you know, they don't get the top marks out of everybody. You know, in things like art or reading or whatever it might be. So you got this child and they're not doing the best of any child in the classroom. How much would you criticize your child?
I don't think I would in that situation. I mean, they're only 5 years old, still very young. As long as they're happy and, you know, the teachers are pleased with how they're doing and everything, it's not their fault, you know.
Okay, so now let's roll that forward 5 years. They're 10 years old and they're still happy at school, and they're still doing okay. They're in the top quarter of the class. They're not doing the best in any particular topic. Would you start criticizing them now for not doing well?
I don't think so. It sounds like, you know, they're doing all right. They're still enjoying themselves. And again, still they're only 10 years old. You can't be too critical.
Okay, well, let's move it another 5 years forward. They're 15. They're just starting their GCSEs. They're still in the same position. They're popular, they're happy, and they're kind of in the top 20% in the class. They're not the best at anything. Would you be critical now?
No, again, I think same sort of scenario. They sound happy, they're doing fine, like doing quite well. I don't think they'd have to be, in my opinion, be doing the best of the best. Like they're already doing well, so.
Okay, so now let's take this back to you. Because it sounds like there was that expectation for you. Was it there at 5, 10, 15? When did you first become aware of it?
Like as young as I can remember, yeah, so probably from 5, you know, I can remember that sort of scenario. Yeah, I'm doing okay, but I'm not the best in the class or anything. And yeah.
Okay, so did the criticism come because you weren't doing the best in class, or did it become because your parents were being critical?
Yeah, I don't know. I find it hard to distinguish. I mean, because I've just grown up with it. They're just always critical, I guess. Yeah.
And now are they still critical?
They can be, yeah, just little things like, you know, even maybe that my mum might pick up on my clothes, like, why are you dressed like that? You don't look very nice, or, you know.
Okay, let's imagine then. It's several years on, you've got this child, they're 25, and their clothes aren't what you would have worn. Perfectly respectable, you know, but they're not what you would have worn. Are you going to be critical of your child then for the way they dress?
No, I don't think children and parents necessarily should have to wear the same clothes like as what you'd have worn back in the day. Like, I don't know, I wouldn't mind. They can wear what they want, I guess.
Okay, so what I'm trying to work out here is, why was there one rule for you and your siblings, which is whatever you do, it's not good enough, and a different rule for how you'd handle your children? Does that mean you'd be handling your children poorly or not?
No, I guess, yeah. I guess it's making sense. Like I obviously think I'm right in this situation now, like looking at it, how I treat my kids is the way.
A critical thing about those core beliefs is that you never focus on the possibility that you're wrong, because they're just who I am type beliefs. So it sounds to me like what you've done is you've grown up believing I'm the kind of person who gets criticized, therefore I must be failing in some way. Is that fair to say?
Yeah, I guess so. Yeah, like you said, that's all I've grown up with. Like I was saying, I don't blame my parents because they were just saying it how it is, sort of thing.
Okay. Now what I want you to imagine is that it's not your child who's been invited to go out with their friends, but you've been invited to go out with your friends. So we'll come back to the here and now. You seem to go into those events with this big expectation of, I'm going to be found out as being terrible. I'm going to be found out to be a real problem.
Mm.
Does that sound sort of believable?
Yeah, and that's why I kind of just have those feelings that everyone's thinking negatively about me.
Okay. So I wonder whether what we've got is the reason you have this belief that other people are going to evaluate you negatively is because that was absolutely how you were treated. And therefore, you build it into your expectation about how the world is. You build in this fear of negative evaluation or fear of negative evaluation of your appearance because you grew up like that for many, many years.
Mm. Yeah, makes sense.
Which means, as far as I can see, that let's say it's Tuesday next week. Your friends invite you to go out for a meal. What you're reacting to sounds not like an anxiety that's based in the, oh my God, they're going to think terrible things about me, but anxiety based in, I'm going to be wrong. And I'm going to be wrong because that's how I was always brought up.
Yeah. Yeah.
I know this is going to sound like a daft question, but when you hear that voice, I'm going to be wrong, I'm going to be found out, whose voice does it sound like to you?
I guess it kind of sounds like my mum and my parents, I suppose.
Okay.
Like it's me saying it to myself, but like it obviously sounds really similar to what I've heard the whole time I've been growing up from them.
Yeah. But this is what we call internalizing. You take on board that this is how the world is, therefore that's how I've got to be, therefore that's who I am.
Mm.
And after long enough, you don't question it because you never questioned it when you were 5 or 3 or wherever it was, because you're a youngster, you depend on your parents.
Mm.
Now, this is not me saying your parents are terrible people, but it sounds like what happened was your parents they'd known, let's say, less affluent times. Maybe they hadn't grown up in quite the sort of degree of positive environment that you were. And this is quite typical. A woman called Marsha Linehan talks about this a lot. You grow up in this kind of more deprived background, you don't ever want to go back to it. So you're not going to let your kids grow up to be less than you are. You want them to do really, really well so they never have to slide back into whatever it was you grew up in.
Yeah.
Do you have any idea about the kind of environment your parents grew up in?
Yeah, it was kind of like that. Neither of them had gone to uni or anything, and they're from quite big families, so they've struggled anyway. Like they've had experiences of their parents struggling to, get the money together. My mum's got 6 siblings. She's from a big family that they've struggled to, feed. And I guess she left school early, got a job, and I think she just didn't want that for me. She wanted me to go to uni, do really well, so I'd never have to worry about that and be the same as, how she was when she was my age.
Okay, so what we're saying is she may have thought she was doing the best she could for you, but she's still stuck in who she is. So she'll still be critical of you for wearing the wrong coat, for example. And that's because, I talked to you about your core beliefs, your beliefs about who I am. Her beliefs may be, my job is to make sure that we never go back again. So it may just be the core beliefs are things where she's got no control over it because it's who she is. What I want you to be able to do is to recognize it enough that you can maybe take some control over it.
Okay. Hopefully that illustrates broadly what I'm talking about, reattribution. It's issues along the lines of, well, look what we're doing here. We're trying to relocate the concern within mum. We're trying to make sure that she's aware mum will see a problem in this particular case, not you, or the other people with the problem in a particular case. And we're not trying to blame other people. Wherever possible, try to avoid blaming people unless it's really obvious they've done something completely mind-numbingly wrong. So if it had been a case of, I was sexually abused by them, then I'd be perfectly happy to go down the lines of that's not something you should have done. But if it's a case of the parents may have been acting in good faith, but acting dumb in good faith, then I'll be saying, okay, let's understand their reasons too. What we're doing is we're trying to shift the attribution from you. If I try to get you to blame your mum, you might think, no, I can't do that. But if we can blame the situation your mum was brought up in or your parents were brought up in, then I've got a better chance of doing it. You also notice that I was, doing the dirty cheat thing of saying, okay, and let's look at some of the background stuff to this. Like, would you do that to your own child? Getting her used to the idea that actually the fact that something crappy happens doesn't mean you then have to locate it all in that individual. Where she's thinking that for other people, but hasn't quite got around to thinking, maybe I don't have to blame myself. So all in all, what we're trying to do is get away from the, it's my fault, it's always been my fault, it always will be my fault, and it applies to all of my life. And this is, if you like, the kind of most straightforwardly cognitive bit that we do when we're working with emotions like anger, shame, guilt, etc. As I said, though, that will not work every time. And the reason it won't work every time is that we sometimes lay down our memories in that very encapsulated way. And again, this ties in with PTSD, very abusive experiences, etc. And I will talk about that next time. We'll have that before we take our summer break. So finally, the last thing I do during during session 5 is try to get an idea about body image targets. So it's just a couple of minutes at the end of the session, but I'd look at the ED15 and I'd say, okay, let's look at the items on there which relate to what we're going to be doing about body image. And I will also look at the person's behavior. How do they dress when they come in the room? Are they dressed very baggily, etc.? Do they sit down very carefully to make sure their thighs don't touch? Anything that gives you an idea about the kind of body image problems that you're going to be facing, so that I know which body image targets I'm going to be looking at. And we'll come back to that, as I say, after the summer break. I'm sorry there's a break for a few weeks here, but we figured you guys would probably want to be able to go away for the summer. So I'll come back to body image, not next week, but after the break. Sorry about that. I just pressed entirely the wrong button there. So we can pick out specific body image targets like, I avoid activities or people because of the way I look, which is item 2, or I avoid looking at my body, or I worry about other people judging me because of how I look, item 10, all of which gives you some indication of what you might be doing once you pass through this early part of the emotion stuff, but we're doing it in parallel with. And that's pretty much it for today. What I'd like you to do in the skills class, sorry, I'm just going to dig out my document. I have prepared a document around this, but I'm going to put it out over the next week. So you've got it for the remaining sessions. What I'd like you to do today is to role play explaining to the patient why their past experiences might have led them to emotionally led binges. So imagine you've got a patient, so around session 5, they're binging, it's very clearly emotionally driven. Can you explain emotional invalidation? Can you explain emotional inhibition? And then after that, I'd like to do a role play where you ask the patient to question the way they blame themselves for those past experiences of being criticized. So those are the 2 bits to play today. If you're going to get to do one, that's fine, but it'd be good if you can get to try both of them. So number 1, how could your past experiences explain the emotion-led binges? And number 2, what could be the attributional patterns here? And could we question them? Okay. Are there any final questions before I let you go get your food? Nope. Okay, well in that case, I will turn off the recording. I'll put everything on hold, and I'll see you guys again in a week's time, and we'll do the second part of the emotional stuff, and we'll also